Obviously, this is quite a serious announcement for the 38 patients who have received information that they may not have expected nor wanted to hear. We do feel that the patients have a right to be informed about the very extremely small risk that they have been exposed to potentially, and therefore we have undertaken the notification exercise as advised by the UK CJD Incidence Panel.
Obviously the risk is low, and we do have to stress that, but for the people affected, they've got basically a life sentence hanging over them now.
Well, I wouldn't put it quite as that. We encourage the people, and we have put that in the letter, that they should carry on with their life as normal. It should not have any implications for their family or for their work that they may be undertaking. The risk is really individually very, very small. And I have to stress that we are undertaking this notification for public health purposes mainly. I do understand that patients will react individually to the information disclosed, and that some may be initially very distressed about the information that they've heard today.
And you have spoken personally to some of those patients?
I have received phone calls from some of the patients. Yesterday I've chosen the route through us rather than through their GP. I have to say that initially both of these patients were quite upset and distressed. But when the risk is explained to them in more detail, and also why this incident has come about, they both, and I can only speak for the patients that I have personally spoken to, have taken the explanations quite well and understand the letter now much better.
How has this happened?
As previously explained, in 2007, a patient who was not known at that time to be at high risk of CJD had undergone surgery in one of the Abertawe Bro-Morgannwg hospitals. The same patient then re-presented to the same surgeon 2 years later, and it became known at that time that the patient was to be classed at high risk of CJD. I have to stress that the patient still remains well and has no symptoms of CJD, but the surgeon at the time in 2009 then rightly recognized this as a potential CJD incident and took the necessary steps, such as identifying the instruments that had been used on the original operation and taking them out of circulation, and informing the national UK CJD Incidence Panel and seeking advice from them.
So everything's been done to the letter. There's no suggestion that anything's happened wrongly. But the problem here is because the sterilisation process doesn't kill the things that actually cause CJD, that's why these people are at risk. Do you think really that that system needs to be changed? Do instruments need to be dealt with differently after all operations?
Since CJD became more prominent in the 90s and early 2000s, some practices have changed in the NHS such that more single-use instruments are used, for example, where that is possible. Sometimes these single-use instruments are not as good as the ones that can be reused, and there is also a cost factor involved. I have to say that CJD overall is a very rare disease, and the current system still mainly caters for the normal infective agents such as viruses and bacteria, which are reliably removed by the normal cleaning and decontamination and sterilization procedures. It is known that prions may survive the temperatures that are used for these normal sterilization procedures, but it's with thousands and thousands of operations taking place in the NHS each day, this has not led to a general change in how instruments are cleaned and sterilized and decontaminated.
So a case like this could happen again?
There is no absolute guarantee that an incident like this may happen again. in the light of this incident, the local health board here in Abertawe Bro-Morgannwg, University Health Board, has looked at the existing CJD policy and reviewed it and probably strengthened it a bit. But as I say, there is no absolute guarantee that a patient may not be recognized at some stage when undergoing a surgical procedure, and information coming to light, such as a new diagnosis in a family or in another patient at a later stage, which leads to this patient being classed as at high risk of CJD.
So people shouldn't be worried by this then?
People who have undergone any type of surgery in ABMU between 2007 and 2009 and have not been informed by us by letter should not be worried about this at all.